Welcome. Today we're diving into a rare and complex condition, Hermansky-Pudlak syndrome, associated interstitial lung disease, or HPS-ILD. This is a journey to understand a condition that intricately connects genetic inheritance with lung health. We'll explore its origins, how it affects the body, and what can be done to manage it. So, what causes HPS-ILD? The root lies in a genetic defect. Hermansky-Pudlak syndrome is caused by mutations in genes that are crucial for the formation and function of organelles called lysosomes and lysosome-related organelles. These organelles are vital for various cellular processes, including the proper storage and transport of substances like melanin, which gives us our skin and hair color, and platelet-dense granules, which are important for blood clotting. Specific gene mutations like those in HPS1, HPS2, HPS3, and others disrupt these processes, ultimately leading to the diverse manifestations of HPS, including the development of interstitial lung disease in some individuals. Let's delve into the pathophysiology, or how HPS-ILD develops. The genetic defect in HPS leads to a buildup of abnormal substances within lung cells, especially within cells that line the air sacs, called alveolar epithelial cells. This accumulation triggers inflammation and scarring in the lungs, a process known as fibrosis. Over time, this fibrosis stiffens the lung tissue, making it harder to breathe and limiting the lung's ability to effectively exchange oxygen and carbon dioxide. The constant cycle of inflammation and scarring gradually destroys the normal lung architecture, leading to respiratory insufficiency. HPS is a rare genetic disorder. Its exact prevalence is difficult to determine, but its estimated effect between 500,000 and 1,000 individuals worldwide. However, some populations have a higher incidence due to founder effects, where a specific mutation is more common in a particular group. Puerto Rico, for example, has a significantly higher prevalence of HPS compared to other regions. The signs and symptoms of HPS-ILD can vary in severity. The most common and earliest symptom is usually shortness of breath, which initially occurs during exertion but can progress to shortness of breath at rest. Other symptoms may include a persistent dry cough, fatigue, and chest tightness. As the disease progresses, individuals may experience clubbing of the fingers and toes, and in severe cases, respiratory failure requiring supplemental oxygen. Diagnosing HPS-I requires a combination of clinical evaluation and diagnostic testing. A thorough medical history, including family history, is essential. Pulmonary function tests can assess lung capacity and airflow. High-resolution computed tomography, or HRT, scans of the chest can reveal characteristic patterns of interstitial lung disease, such as ground glass opacities and fibrosis. Genetic testing can confirm the diagnosis of HPS by identifying mutations in the relevant genes. In some cases, a lung biopsy may be necessary to examine the lung tissue under a microscope and confirm the presence of fibrosis. While there aren't distinct types or classifications of HPS-ILD beyond underlying genetic mutations that cause HPS, the severity and rate of progression can vary significantly between individuals. Factors such as the specific gene mutation involved, environmental exposures, and overall health can influence the disease course. Unfortunately, there is no cure for HPS-ILD. Treatment focuses on managing symptoms and slowing the progression of the disease. This may include using medications such as corticosteroids or immunosuppressants to reduce inflammation and slow down the fibrosis process. Pulmonary rehabilitation programs can help improve breathing techniques and exercise tolerance. Supplemental oxygen may be required to maintain adequate oxygen levels in the blood. In advanced cases, a lung transplant may be considered as a last resort. Since HPS is a genetic condition, there is no way to prevent it from occurring in individuals who inherit the affected genes. However, genetic counseling and testing are available for families with a history of HPS to assess their risk of having children with the condition. Prenatal testing can also be performed to determine if a fetus has HPS. The prognosis for individuals with HPS-ILD varies. The disease typically progresses over time, and the rate of progression can differ significantly. Some individuals may experience a slow decline in lung function over many years, while others may experience a more rapid deterioration. The median survival time after the onset of respiratory symptoms is approximately 8 to 10 years. Research is ongoing to develop new and more effective treatments for HPS-ILD. Some studies are exploring the use of antifibrotic drugs, which have shown promise in treating other forms of interstitial lung disease. Gene therapy is also being investigated as a potential future treatment option. Understanding HPS-ILD is an ongoing process, and we hope this overview has provided valuable insights.